Hi, I'm Gloria Coppola from Massage Pro C.E. Today I'm at Oakworks. We're filming on craniosacral therapy. You may have just seen my previous video on how to palpate the listening stations. We're going to come over to our lovely volunteer here today, and I'm going to show you how to work a little bit within the cranium and describe what it is we're feeling and why we're doing this. So in the earlier clip, I found a little bit of imbalance going on with our model today. And so I want to tune in a little further to her cerebral spinal fluid to feel where things might be out of alignment within that space of her dural tube. And I can do that because my palpation skills are very fine-tuned. I'm going to place her hand in my soft palm on the occiput here, and my other hand on her frontal bone. Now, with craniosacral work, we don't usually initiate, movements for somebody. We wait for the body to respond. But occasionally, we might have to add a little bit more than 5 grams of pressure just to get something induced. So what I'm tuning in on our client today is how this fluid is actually flowing up and down from her sacrum all the way up into her cranium. And I'm adding just a few extra grams of pressure to initiate a little bit more of movement and flow into the back, into her neck and into the base of her occiput. So fascially, I'm connected with that connective tissue. And then I'm going to slowly release it and allow it for release. And let it take on its own pace. So, were you able to feel that?
Yes.
What did you notice?
A slight pressure and then the release, and it seemed to help my muscle relax in my neck.
Good. It also makes the client aware of where they're holding. And I like to encourage breathing. Breathwork is very powerful, not only in craniosacral work, but in all massage, in my opinion. So if you would just, while I'm doing this frontal occipital hold, just take some nice, deep, slow breaths in and out. This also helps facilitate a relaxation response. It allows for the parasympathetic nervous system to kick in and let their muscles begin to just let go. Now sometimes when we're doing these holds, the body might move slowly, the neck into certain directions. We don't push it there. We follow it. What I'm feeling underneath her frontal bone right now is like it's going in a circle almost. Can you feel that?
Mm-hmm. Yes.
So it feels like the left side of her frontal bone is actually lifting a little bit. And now it feels like it is sliding over to the right. Are you aware of that?
Yes.
Now, if your client gets sinus type of headaches, or maybe has had a frontal lobe injury, you might find that this bone is a little adhered, a little tight, fascially it might be restricted in there. And so you're going to sense and feel how this is moving under there, how the connective tissue is beginning to unwind, and so that this space gets opened. Sometimes clients will tell me while this is happening that they could actually feel their sinuses beginning to open and drain. So it's a great technique to learn when you take your training to help relieve sinus pressure and headaches, as well as work the entire dural tube. You can notice that the head is starting to tilt to the right a little bit. I'm not bringing her into this position. I'm following her movement. And I've got a slight engagement again with this connective tissue to allow her body to just open up, release, and unwind. Now, in our earlier video clip, I had noted that her left shoulder had an asymmetrical craniosacral rhythm, and it was very quiet and still. So it doesn't surprise me that her head is beginning to tip to the right to open up some of that restriction that might be happening in her shoulder. Anything you want to share?
Feels good.
Feels good? So in a craniosacral training, you'll learn how to work within the whole body from the sacrum all the way up to the cranium. You'll learn how to release in what we call diaphragm spaces, how to connect with the myofascial system, how to feel for what they call energy cyst, and techniques to help relieve the restrictions and or the pain or the dysfunction that a client might have in those regions. So you notice while I'm talking, our client's head is moving in different directions. Again, I'm just feeling her, following it. I'm not doing this. I'm not initiating it. I'm listening on a really deep level to what her body is telling us. Dr. John Upledger, who developed craniosacral therapy, talks about the body having an inner wisdom or an inner physician, meaning our body knows what it needs to do. All we have to do is show up, pay attention, listen, and be present for our client. In my career as a craniosacral therapist, I've gone to the advanced levels. I've been a teaching assistant for the Upledger Institute, and I've even done their teacher training program. In each training that I got to assist, I found I learned more and more that I didn't get it all in one training. So if you just take one, it's not enough. You're always going to miss something. I've had phenomenal results with craniosacral work for headaches. Very rarely does a client leave with their headache, unless it's of a vascular nature. And I've also worked with children with autism and cerebral palsy, and had phenomenal results with both of those as well. In my earlier video, I also mentioned it is an effective modality for fibromyalgia, and I worked with clients with fibromyalgia for many years, noticing that this is one of the best techniques that they respond to. So I hope this gave you a little idea of what craniosacral work can do, what it's capable of doing. And if you have any questions, you always can contact me at massageproce@gmail.com. And for classes in your area, you can check out my website at www.massageproce.com. I want to thank you today for being my model, as her head and neck continue to unwind here as we say goodbye from Oakworks.